Hello, this is Neil Baum providing the second video on how to be more efficient and more productive. In the first video, I gave you 5 suggestions for enhancing efficiency, and now I'd like to provide 5 additional suggestions for enhancing efficiency, and hopefully that you would be home for dinner. The current problem is well known to all of us. Our reimbursements are going down, overhead costs are rising, and we're losing income. The solutions are hardly going to be increasing reimbursements. That's not going to be possible. We can, however, try to lower overhead costs, and we can improve efficiency. An example, number 6, of improving efficiency is to complete forms for the patient before they come to the office. If a patient has a 2 o'clock appointment and arrives at 2 o'clock, it might take him 20 or 30 minutes to complete the demographic forms and the health questionnaire. This can be alleviated by asking the patient when they call for an appointment to complete their forms online and hit the submit button, so this information goes to the practice and the patient can be seen on time and not wreak havoc on your schedule by being delayed to fill out those forms in the office. Number 7, make an effort to obtain prior authorization. This causes significant delays if this is not obtained prior to the patient's appointment. By obtaining prior authorization, you can see that you'll enhance the productivity and the efficiency and performance of your practice and will not have delays taking place in the office in order to obtain that when the patient arrives in the office. Number 8, a scribe. You have received multiple videos on the use of a scribe, and the question I raise, I'm not going to go through the concept of the scribe in its entirety, but we really don't need to go to medical school to ask a patient, what medications are you taking? What previous surgery have you had? How much alcohol do you drink, and do you smoke? This can be done by someone else. In my practice, I go to see the patient first. I use the sandwich technique and see the patient first. I tell them that a assistant is going to come in and ask a few questions, and then I return at the end of the visit to make sure all of their questions are answered before terminating the doctor-patient relationship. One of the main complaints that patients are having today is that the doctor is spending too much time looking at their screen or their computers and not looking at the patient. By using a scribe, you can focus and be eyeball to eyeball with the patient. The economics of a scribe are very easily computed. You need to see 1 to 2 extra patients a day in order to afford a scribe. If you can see just 1 extra patient per hour, which is easy to accomplish, you can increase your annual revenue over $125,000. You've had multiple videos on the use of telemedicine in your practice, and I'm not going to go through the use of telemedicine or the coding associated with telemedicine, but I want to point out that telemedicine is also very useful to fill no-show gaps in your schedule. Patient cancels, you then go to your telemedicine and have patients waiting to have a virtual visit. Also, I want to point out that telemedicine is going to play a role in the very near future for some postoperative patients. There was an article in a European urology journal that indicated that uncomplicated post-prostatectomy patients were followed using telemedicine, with the outcomes being exactly the same as those patients who were returning for face-to-face office visits. Finally, number 10, I recommend having a 15 to 20-minute segment every day, and I called it sacred time. And that 15 minutes was left open every day for urgencies and emergencies and possibly to see a new patient. Now, when the patient calls and says, I have a problem, I need to come in today, they aren't told just to come on in and we'll work you in, because that throws your schedule off. They are then given the sacred time slot, and it allows you to stay on time. I can assure you that that 15-minute time slot that you are saving for urgencies and emergencies will get used nearly every single day. Bottom line, successful practices are going to use technology to enhance their efficiency and their productivity. And most important of all, if you are efficient and productive, you can be home for dinner. Do you have any questions, or you would like any further information, including white papers on the topic of efficiency? Kindly let me hear from you. Also, if you have suggestions regarding efficiency and productivity, kindly contact me and we'll perhaps use it in a future video. Thank you.